South Korea is notorious for having high suicide rates, in fact, the highest among the OECD members. To bring down these high suicide rates, the government this week sketched out a set of new measures. For more, we have our Choi Soo-hyung here in the studio. Welcome back, Soo-hyung.
Good to be here again, Dami.
So, Soo-hyung, South Korea having such high suicide rates, this is nothing new though, right?
Yes, Dami. Paradoxically for us, the fact that the suicide rate is high doesn't seem that unfamiliar. Since 2003, South Korea's suicide rate has consistently ranked first among OECD countries, except for the years 2016 and 2017, when it ranked second, following Lithuania. The problem is, the rate is about twice that of the OECD average. Last year, the suicide rate was 25.2 people per 100,000, about 2.3 times higher than the OECD average of 10.6 people.
Which is why the government, the lowering the suicide rate has long been the government's one of top to-do list, right? Walk us through what's been done so far.
Yes, Dami, the previous policy was focusing on after-the-fact treatment and was more passive. Moreover, officials said there was a lack of integration and sharing of real-time suicide management data among government departments, leading to insufficient coordination. Additionally, there has been a shortage of active promotion to improve awareness about mental health problems and counseling procedures within different age groups and with different symptoms. To break this cycle, the Ministry of Health and Welfare unveiled a new initiative on December 5th that aimed to better deal with mental health issues. President Yoon Suk-yeol presented the government policy vision to address mental health issues and to enhance the quality of life of sufferers.
특히 저출산 시대에 국민의 정신건강 문제를 해결해서 개인의 역량과 삶의 질을 높일 때 국가 성장을 견인해 나갈 수 있습니다. 정부는 이제 예방치료 회복에 이르기까지 전 과정의 지원 체계를 재설계해서 정신건강 정책의 패러다임을 획기적으로 바꿔 나갈 것입니다.
So a lot has been done to really tackle that issue, but what makes this new initiative any different from the previous ones?
First, to improve on these old mental health policies, the new approach is more proactive and highlights 4 key tasks. Firstly, the government aims to build a system that's integrated into daily life. People can check their mental health quickly and easily by mobile via the messaging application KakaoTalk, and a brand new number 109 will be launched to integrate suicide prevention emergency hotlines. Secondly, there'll be swift and continuous treatment and management for patients with a severe mental illness. The government also will increase financial support for outpatient care by keeping in touch with those who have had severe mental health problems. As for the long-term strategy for people with severe mental health issues, there'll be better housing support for economically independent living. They will also be officially recognized as a socially vulnerable group, and more people will be eligible for medical insurance, even if they have a record of mental health issues. At the moment, some insurance companies don't offer cover to such people. Lastly, there will be improved awareness of mental illnesses to dispel prejudice. Efforts will be made through nationwide campaigns and university club activities so that mental illnesses are seen in a similar way to physical ailments.
So what the government is trying to say is it's trying to detect the disease at an early stage, and the government is also trying to achieve that 0.5% drop in the rate by within a decade, right?
Yes, with these 4 key tasks, the Yoon administration is seeking to cut the suicide rate by 50% within a decade. Especially considering the increased rate of suicide among young people last year, the plan is to shorten the mental health checkup interval for young people from 10 years to 2 years. Additionally, through the Employee Assistance Program, it aims to link counseling services within the workplace, including specific coaching services to reduce anxiety and stress. The government has also announced plans to increase the employment rate for people with mental disorders from the current 10.9% to 30% as part of efforts to enhance awareness. The Minister of Health and Welfare Ministry, Choi Soo-hyung, expresses aspirations.
The government will provide mental health care services to all nationals and residents whenever and wherever through these policies, and build a society where people with mental illnesses can integrate into society without problems.
Though a specific start date hasn't been revealed, through these four main strategies, the government plans to provide psychological counseling to 1 million people by 2027 and reduce the suicide rate by 50% within 10 years.
Sure, let's see how policies at this time will actually help curb those high rates. Thank you so much for that report, Soo-hyung, today.
My pleasure.